that how you envision it being used, where people would kind of check you out maybe first?
Well, there's multiple uses, as Dr. Koplow was saying. Mel has many aspects of this. One is it's a very good way of people getting to know what doctor they're going to see. And it's great. There are patients who go on the site and they come to see me and they start talking to me like they know me already. It's also wonderful, and one of our concepts is to help pediatricians get their own site. In other words, it's very expensive, it's very time-consuming and difficult to create your own website. But Mel has it down to a science. As a pediatrician, he can go in and interview anyone and give them the right questions. You know, if you get someone like yourself, nothing personal, but, you know, you're going to go on, you're going to start asking me legal questions.
Okay.
Oh, okay, then that's fine. I mean, if there's a Yankee fan on this or anything you want to know. But Mel, as a pediatrician, can go on and ask the pediatrician certain questions. He'll ask me certain questions because he's knowledgeable. It makes it a very unique site. The other thing, I think, is basically at some point, his dream is you literally have a virtual office. In other words, let's say someone wants information about
autism,
the heart, or
okay.
autism.
All right, the heart.
Okay, you walk in, and there's a virtual person. May I help you? And you can click on or say, attention deficit disorder. And next thing you know, all of these lectures come up, and you can actually get that information, whether it's a physician or potentially a patient or a patient's family. The other thing, which I know is a dream of his, and he mentioned this briefly, is about competitiveness. Hospital administrators compete. Pediatricians, I think, are the first group that always are willing to talk to each other, and we're non-competitive. So there are hospitals that have certain levels of care, and other hospitals have other levels of care. Okay. And by uniting through a site like this, one would hope that if our hospital does something that no other hospital in the area does, that hospital will say, you know what, let's send our kids to that children's hospital. And we would say to a family, look, you have a problem that can be taken care of next door.
Right.
So by getting all of these physicians, many, many physicians on the site from different institutions, this is not about one hospital. It's basically about a conglomerate of hospitals that are going to work together.
Now, the site is strictly a pediatric site?
Well, I get a lot of the issues with an adolescent sort of like border with adult medicine. So we're slowly adding internal medicine. I got an adult urologist discussing, the cancers that would affect more of an adult than a child. But, sometimes you can even get a prostate cancer. It's very rare in a kid. In a late adolescent, we discussed that. But we still try to keep toward more pediatrics.
Any interesting stories of patients that came in after viewing the site? Families, parents, they viewed it, they were familiar?
I mean, I don't want to get personal, but Mel had a patient, and the patient, this child has a problem that can be taken care of in many institutions. And, I don't always know when a patient comes to see me, immediately who the pediatrician is. Eventually I ask. But it turned out that this patient was referred by Dr. Koplow and felt incredibly comfortable with me because they had been on the site. Right. Mel has also gotten, his site is on YouTube and other places. And it's amazing how people from all over the country will see us and ask for advice. And obviously one has to be very careful about giving advice because you can't give specific advice to a patient. Right. You can give generic advice. But it is truly remarkable how this site has become popular, and it's very popular with the doctors. Doctors love to look at these when they've been videoed, and they love to see themselves on the website. We're trying to get our hospital